Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to recognize and treat a yellow jacket sting. Yellow jacket stings can cause extreme pain, redness, swelling, and itching. For most people, yellow jacket stings are not dangerous and can be treated with an ice pack and over-the-counter, OTC, antihistamines. /r/n/r/n. On the other hand, people who are allergic to yellow jacket venom may experience a potentially life-threatening reaction known as anaphylaxis. People with signs of anaphylaxis including hives, swelling, and breathing difficulty need an immediate injection of epinephrine to avoid shock and even death. /r/n/r/n. By recognizing the signs of a severe yellow jacket sting, you can call 911 and seek emergency care before the reaction turns deadly. /r/n/r/n. A yellow jacket, also known as yellow jacket, is the common name of a type of wasp belonging to the Vespula or Dolichovespula genus. /r/n/r/n. There are many species of yellow jackets native to North America, including the North American yellowjacket, Vespula alascensis, eastern yellowjacket, Vespula maculifrons, western yellowjacket, Vespula pensylvanica, prairie yellowjacket, Vespula atropilosaand, and aerial yellowjacketDolichovespula arenaria. /r/n/r/n. Yellowjackets are social hunters that live in colonies consisting of a queen, workers, sterile females, and males, drones. Only females can sting. /r/n/r/n. Yellowjackets are recognized by their distinctive markings. A typical worker is about ½ inch long with alternating black and yellow bands on their abdomen. /r/n/r/n. Because of their size and coloration, yellowjackets and honeybees are sometimes mistaken for each other. But there are several key ways to tell them apart. /r/n/r/n. Yellowjackets have an elongated abdomen and narrow waist. /r/n/r/n. Yellowjacket bodies are smooth. /r/n/r/n. Yellowjackets have longer, smooth legs. /r/n/r/n. Yellowjackets fly erratically and move in a side-to-side pattern before landing. /r/n/r/n. Yellowjackets often build nests in the ground, especially Vespula species. /r/n/r/n. Yellowjackets are aggressive and will chase you if threatened. /r/n/r/n. Honeybees are rounder with a thicker waist. /r/n/r/n. Honeybee bodies are fuzzy. /r/n/r/n. Honeybees have flattened, hairy hind legs that collect pollen. /r/n/r/n. Honeybees tend to fly in a straight pattern, a beeline. /r/n/r/n. Honeybees never build their nests on or in the ground. /r/n/r/n. Honeybees are generally non-aggressive and will not chase you when threatened. /r/n/r/n. When a yellowjacket stings, its barb-like stinger pierces the skin and injects you with venom consisting of toxins called masteprine and phospholipase A1 and A2. Unlike bees, yellowjackets can sting you several times. /r/n/r/n. In people without a yellowjacket allergy, exposure to the venom causes localized symptoms, such as /r/n/r/n. The acute pain can last for as long as 2 hours before gradually easing. Burning, itching, redness, and swelling can last for several days. /r/n/r/n. Borchi, Getty Imagesrnrn Unlike bees, a yellowjacket will not leave its stinger behind once you've been stung. As such, you won't need to pull out the stinger as you might with a bee. /r/n/r/n. Systemic, whole-body, allergic reactions to insect stings affect up to 5% of the U.S. population, according to a 2019 study published in the Journal of Asthma and Allergy. In some people, this can lead to a potentially life-threatening allergy known as anaphylaxis. /r/n/r/n. Anaphylaxis is considered a medical emergency. Symptoms tend to appear within 2 hours of a sting and, in some people, almost immediately. /r/n/r/n call 911 or seek emergency care if you or someone you know develops signs of anaphylaxis after an insect sting, including /r/n/r/n delayed reactions, known as biphasic anaphylaxis, are common with food and drugs but uncommon with insect stings. /r/n/r/n if left untreated, anaphylaxis can lead to anaphylactic shock, coma, asphyxiation, cardiac or respiratory failure, and death. In highly allergic people, death can occur within 20 to 30 minutes of the appearance of symptoms. /r/n/r/n beyond the risk of allergy and anaphylaxis, yellow jacket venom can cause potentially deadly complications in people who experience a massive attack. /r/n/r/n yellowjackets are far more aggressive than bees and more likely to launch a group attack if their nest is disturbed or threatened. When provoked, the insects release chemicals known as pheromones that recruit other yellowjackets to join in on the assault. /r/n/r/n mastoprene and phospholipase A1 and A2 found in yellowjacket venom are both highly toxic and, if delivered in a high dose, can lead to a cascade of severe complications, including /r/n/r/n even if you have no signs of allergy. You should seek emergency care if you have been stung multiple times by yellowjackets. /r/n/r/n it takes around 1,500 stings to kill an adult male, particularly those with a low body weight. A child may be killed by as few as 300 stings. /r/n/r/n if you've been stung and are experiencing pain and swelling without other symptoms, you can treat the wound by following these steps. /r/n/r/n if needed, take an over-the-counter oral antihistamine like Benadryl, diphenhydramine, to relieve mild itching and swelling. It can also help you sleep if the pain and itching is particularly severe. /r/n/r/n home remedies include the topical application of apple cider vinegar, a topical paste made of baking soda and water, or a commercial meat tenderizer to help ease swelling and pain. /r/n/r/n without exception, anaphylaxis is treated as a medical emergency. The treatment starts with an injection of epinephrine, adrenaline, to help counter the allergic response. Epinephrine also prevents a massive drop in blood pressure that can lead to shock by causing blood vessels to narrow. /r/n/r/n the treatment of anaphylaxis may also involve the intravenous, antihistamines and cortisol, a type of steroid, along with oxygen therapy and inhaled albuterol to help open your airways. /r/n/r/n if you have a history of anaphylaxis or have experienced a severe reaction to an insect sting in the past, you may be advised to carry an epinephrine autoinjector, called an EpiPen, in case of an emergency. /r/n/r/n the best way to avoid yellowjacket stings is to keep a safe distance from them. Yellowjackets are naturally aggressive and will only get more aggressive if you try to shoo them away. Provoking them with smoke and insecticides may increase your chances of being stung. /r/n/r/n yellowjacket nests require removal by trained pest control specialists. /r/n/r/n yellowjackets are scavengers readily attracted by sugars and proteins in picnic foods, including meat. You can reduce your risk of attracting yellowjackets by /r/n/r/n if you are eating outdoors and find yourself surrounded by yellowjackets, leave the scene immediately. /r/n/r/n if you are at risk of anaphylaxis, your healthcare provider may refer you to an allergist for insect venom immunotherapy, also known as allergy shots. /r/n/r/n the aim of immunotherapy is to desensitize you to the venom by introducing tiny amounts into your body over time. If successful, immunotherapy may help prevent anaphylaxis if stung, although it may not erase all of your allergy symptoms. /r/n/r/n yellowjacket stings are very painful, causing swelling, redness, and itching around the sting site that can sometimes last for several days. Some people experience an anaphylactic reaction to a yellow jacket sting, which is a life-threatening emergency. /r/n/r/n Uncomplicated stings can be treated with ice, topical steroids, and OTC pain relievers. Learning how to identify yellow jackets and their behaviors is the best way to prevent stings in the first place. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.